In Chapter 20, know the characteristics of an individual with sex addiction and compulsivity, and know the concerns commonly encountered during a sexual addiction intervention. In Chapter 21, know the characteristics of a codependent individual, and know whether treatment for codependency works best when it is treated as a primary or secondary disorder. In Chapter 22, know the group of individuals most susceptible to Internet addiction. In Chapter 23, know what dual diagnosis is, as well as its most common symptom, and know what is included in discharge planning for dual diagnosis clients. Know, for example, that research shows that over 70% of all substance abusing individuals suffer with some sort of mental illness. Regardless of which may have occurred first, it is important to treat the co-occurring disorders concurrently. Recognition of these co-occurring problems, which may be outside the scope of the addiction recovery counseling professional, make it important to refer such clients to the appropriate treatment professional, such as physicians, mental health professionals, so that a client's treatment plan can concurrently address all disorders. And the most common psychiatric diagnoses among chemical abusers are anxiety and mood disorders. In Chapter 24, know the reasons that individuals choose to become counselors. Know counseling misconceptions, such as, I need to get the client to see the error of his ways and change them, or get intense, otherwise it doesn't work. And know the major roles of the counselor, such as motivating the client and providing hope. Understand the differences between the traits of an effective, naturally therapeutic counselor. Be able to distinguish between those if you are given the name of, for example, empathy. You should know what makes up the empathy trait. And know what transference and counter-transference refer to, and understand what feelings of the client and/or counselor may give rise to either. In Chapter 25, know that it is important for counselors to provide a comfortable and non-threatening, non-judgmental atmosphere and treat the client with respect no matter what their background. Understand some of the differences between male and female alcoholics, such as women usually begin drinking or problem drinking at a later age. Women move more rapidly from the early to later stages of drinking, with faster physical deterioration, getting sicker earlier, and developing associated health problems more rapidly. And female alcoholics are more likely to have affective or emotional problems, whereas males are more likely to have sociopathic problems. Know and understand the three-pronged counseling process, be able to distinguish between all three of them, and be able to identify patterns of negative thinking, for example, overgeneralizing. In Chapter 26, know helpful and unhelpful statements in a group counseling process. Know about the advantages of groups, how to fulfill individual needs through the group process, know about the limitations of groups, and also know how to structure the group relationships, such as including time limits, counselor versus client agendas, and role limits. Know all 5 of these items. In Chapter 27, know and understand the stages of development in the CD-affected family, and know the process to follow in a family and couples counseling program. In Chapter 28, be able to identify behaviors associated with the progression of adolescent chemical dependency, understand the various treatment elements such as a negotiated contract with the adolescent, and know who should be involved in the development of an aftercare plan. In Chapter 29, know that we can learn from failure and also know the goals of personal growth examination. In Chapter 30, this is important information if you are seeking the nationally administered registered addiction specialist credential held by addiction professionals located in 47 states. However, this tutorial is designed for CATC certification candidates, and there will be no questions on the exam on this chapter. In Chapter 31, you should understand the meanings of relapse and recovery. You should understand the situations when relapse is more likely to occur and what questions should be asked, and the factors that will assist in a sober recovery. In Chapter 32, understand the components of psychoanalysis, understand the characteristics of person-centered therapy, understand the characteristics of the rational emotive therapy, understand the characteristics of behavioral therapy, and understand the 3 R's of reality therapy and be able to distinguish between each one of those therapies. Chapter 33 has some very good information for a counselor, assertiveness for the counselor, and good information for personal and professional growth for the counselor, but there will be no questions on the exam on this chapter. Chapter 34 is a very important chapter, and you should know the information in this chapter very well. This chapter deals with the laws, ethics, and confidentiality, and you are likely to get a good number of questions on the information in this chapter. You should know and understand the meanings of all the terms and legal issues involved in treatment throughout this chapter, especially those identified in bold type, such as standards for client care, implied contract, and other terms. You should understand very well the laws related to confidentiality and under what circumstances information about a client may be released. Written consent to release information is required, and it must include specific information identifying the person or agency to whom the information may be disclosed, the reason or purpose for the release of the information, the type of information that may be disclosed, and the specific expiration date or event upon which the consent expires. Remember that the client is the holder of the privilege, and a subpoena is not sufficient to disclose such confidential information. Rather, disclosure would require a court order signed by a judge stating the reason and specific information requested. Information may not be revealed about a client without specific written consent or court order, except in limited circumstances. For example, in cases where there is reasonable suspicion of child abuse, regarding internal communications within a facility, for a medical emergency, or if there is imminent danger to the client or another person. And finally, in this chapter, understand the reasons for the tradition of anonymity in Alcoholics Anonymous. Understand the professional counselor's obligations to other professionals, and understand the ethics of information that may be disseminated in publication and public speaking. Chapter 35 is another important chapter, especially for practitioners. The information provided in Chapter 34 and 35 involving ethics, confidentiality, and sexual harassment, these are the areas that get most counselors into trouble by their certification board or licensing board, so you want to make sure you know this information very well for the exam as well as during your professional practice. In Chapter 35, make sure you understand the components of the protections afforded by the Civil Rights Act, the Age Discrimination and Employment Act, Americans with Disabilities Act, and the Equal Pay Act. Know each one of these acts and know what the components are as well as how to distinguish between them. Understand what constitutes sexual harassment, in which circumstances it may occur, and what, according to the U.S. Equal Employment Opportunity Commission, is the best tool to eliminate sexual harassment in the workplace. Chapter 36 is introductory information related to being a competent clinical supervisor or manager in an AOD-SUD program. You should know the meaning of various terms and approaches of supervision, such as confrontation counseling. You should know about the primary complaints employees often have about management. You should know the considerations in conducting performance reviews with staff members, and know the specific skills and techniques of active listening when interacting with staff members. And Chapter 37 is the final chapter of the Addiction Professional, and this summarizes the TAP 21 competencies and 12 core functions. Make sure you fully understand and are able to distinguish between the counselor competency standards of the 12 core functions and the TAP 21 competencies. Know and understand the meaning of every one of the 40 terms within the TAP 21 glossary of terms and be able to distinguish between them. And finally, know and understand very well the 8 counselor competency criteria identified within the TAP 21 standards, such as clinical evaluation, treatment planning, etc. We will now switch to the Intervention, Treatment, and Recovery textbook to cover the 8 practice dimensions within TAP 21, as well as other information to help round out this tutorial. Remember, you may see some overlap of the information referred to in the Addiction Professional, but use this as an opportunity to reinforce the information you have learned. Chapter 2 of Intervention, Treatment, and Recovery points out that science has revolutionized the understanding of drug addiction, such as the ability to conduct brain scans of drug abuse patients, and as a result, we know that addiction is a disease that affects both the brain and behavior. Be able to identify the definition of addiction as a chronic, relapsing brain disease characterized by compulsive drug seeking and use despite harmful consequences. Be able to identify the harmful consequences of drug abuse and addiction to babies, adolescents, and adults. And know the medical consequences of drug abuse, such as cardiovascular and respiratory effects, the effect upon the liver, mental health effects, prenatal and other health effects. What is comorbidity? How prevalent is it? 6 of 10 with a substance use disorder are said to also suffer from another form of mental illness. Are there differences in rates of comorbidity by gender? Antisocial personality disorder is more prevalent in men, while women have higher rates of major depression, PTSD, and other anxiety disorders. In Chapter 3, know about the various, not exhaustive, evidence-based treatment approaches identified. Pharmacotherapies, behavioral therapies, approaches used by substance abuse treatment facilities, and understand their respective strengths and be able to distinguish between them. Also know about the family education group when involved with a family member with a substance use disorder and be able to identify who should and should not be included. Know that the family education goal is not family therapy, but rather to present accurate information about addiction, to provide a forum for communication to discuss recovery issues, to teach and encourage family members to care for themselves, and to encourage participants to get to know other recovering people and their families in a comfortable and non-threatening environment.